Your thoughts coming up next. The expert from Blue Cross Blue Shield about the Affordable Care Act, Luther Stueland, joins us. Also, if you get any questions about with the deadline coming up here on March 31st about getting signed up for the Affordable Care Act, please text or email us to us now. Very easy to do. Go to our website, 630pov.com. We'll be right back. In less than 1 week, the Affordable Care Act deadline is upon us. March 31st is the exact date. With us tonight, the Director of Health Policy Impact from Blue Cross Blue Shield of North Dakota. That's a mouthful of a title. Luther Stueland, thanks so much for being here.
Thanks for having me.
I want to run through some stats first and talk about, so what does this deadline exactly mean? So over 36,000 people in North Dakota initially lost insurance because of the Affordable Care Act, 31,000 of those being Blue Cross Blue Shield people. Since March 1st, or as of March 1st, I should say, 5,238 enrollees via the healthcareexchange.gov. I'm assuming that number has gone up, and do you have those figures?
Well, to put it in context, we're selling products both on and off the exchange. The exchange is the new marketplace that's run by the federal government where people can get tax credits for purchasing their health insurance. We're also selling those products off exchange as well, so the numbers wouldn't reflect those members that we've gained off exchange. But yeah, we had to terminate policies due to the ACA and offer new policies that are available for sale now in 2014.
And help me understand this, because I know President Obama came out. In fact, I think we had Mr. Von Ebers on the day he came out and said, look, you know what, if insurance companies now want to extend this and offer those policies, they can. Why didn't you do that?
We really wanted to, but in the end, it was too late. What happened was that we had priced our products assuming a certain transition of those members into these new metallic products, and it was the accommodation came at such a late hour that we wouldn't have been able to modify those, and we would have lost significant amount of our member dollars.
So let's talk about that, because I do want to get to this deadline in a moment, but also I know that you had asked North Dakota Insurance Commissioner Adam Ham for basically a 19.5%, 20% increase in premiums. He said, you're only going to get it to 14.4. Why did you need the 19.5, and what does it mean now that it's only 14.4?
Yeah, well, in addition to some of the taxes and fees that are included with the Affordable Care Act, the claims trend that we've seen in the past, particularly in the past year, has been much higher than we had anticipated. And so really it was trying to make up for the premiums that we need to pay the claims for those members that have that product.
But from what I'm hearing, and maybe this is just nationally, is that the Affordable Care Act is starting to lower the cost curve or bend the cost curve on health care. Is that not accurate?
That might be a national trend, but of course we have to price our products based on the claims trend, the actual trend that we see in North Dakota, and the amount of claims that our members are using needs to be supported by premium in order for us to stay afloat.
Thus, you also didn't become part of the Medicaid expansion as well, right?
That was another decision, a tough lift at a late hour, and in the end, we couldn't make that work with the amount of risk that we were being asked to take on.
So the 14.4% definitely going to happen in 2014 for Blue Cross Blue Shield people, yes?
That applies to our grandfathered individual market, and so for that group of individuals, that's the increase for 2014.
Are you hearing people that are signing up via the healthcareexchange.gov, are their premiums lower or higher than what they had at one point?
Well, we've probably talked about this before. It kind of depends on who you are and depends on what kind of product you had before. Of those products that we offered previously, the plans ranged in value from, say, a 90% actuarial value down to a 55% value. And so we had to fit, the new products had to have actuarial values within narrow bands, the bronze, the silver, gold. And so some people would see an increase, some people would see a decrease, but it really depended on what you had previously. Because both the coverage and the types of benefits that are in that plan are different.
Okay, so what I'm understanding now is that obviously the Supreme Court came out and said, look, this is going to be labeled as a tax, which I didn't know our Supreme Court could levy taxes, but that's how it's been labeled. And that obviously was for the individual mandate, which was going to sort of give this thing the finances it need to make it work. And now I'm hearing via the Huffington Post, also Bill O'Reilly, that essentially there's a hardship clause where you can say, hey, it was too hard for me to get on the website, or it just was too difficult for me to navigate it. And if you can claim the hardship clause, you aren't going to get taxed and thus pay the penalty. And does this thing essentially implode?
Well, we knew first of all that the mandate the first year was not very strong to begin with, and so its intent was to encourage younger and healthier people who wouldn't normally have an incentive to purchase coverage to nudge them to do that. And so the intent was that if we got younger and healthier people in the pool, then the premiums could come down for everybody. Now, when it comes to the exemptions and the hardship, those are exemptions that existed previously. When they came out with the rules, I just say that I would be uncomfortable myself taking an exemption for hardship, but that's just something that people will have to decide for themselves whether or not they think they can qualify for those exemptions or those.
So what happens if I don't sign up by March 31st?
March 31st is what's called an open enrollment period end. And in the individual market, so if you don't have insurance from your employer or from the government through Medicare or Medicaid, so in the individual market, you have to purchase coverage during that open enrollment period, and if you don't, you really can't get coverage until the next open enrollment period, which doesn't start until November 15th. The only exceptions to that is if you were to have a life-changing event, if you were to get married, or if you were to have a child, you could add the child at that point.
But I was always understanding that, okay, if I don't get it, but all of a sudden I get sick, I can obviously just go and sign up for this, get my insurance, and then use that at a later date.
It's really not the case, and I think that's probably one of the misconceptions is that you could just buy insurance at any point. You can buy insurance without what we call medical underwriting, but it has to be during an open enrollment or special enrollment period due to a life change.
So if I don't get insurance by March 31st and I go and have a catastrophic event, what I'm hearing you say is I'm basically on my own until November 15th.
That's the way the enrollment periods are written, yes.
Wow. Anything else you want to add?
Well, I would encourage people to look at the types of tax credits that are available on the health insurance marketplace. The marketplace is working better than it was previously, and people can save money. It's a tax credit. It's an advanced tax credit, so they can take it as an advance towards their health insurance premiums, or they can take the credit later in 2015 when they file their taxes.
Is there a leg to stand on via this hardship clause, in your opinion?
You know, in the end, I think it becomes a matter of how tightly the federal government wants to enforce that or wants to hold to that, and so I'll leave it up to them.
I mean, this thing is massive, and you and I were just talking off camera about it. Look, I've been trying to follow this thing as best I can. I don't know about you out there, but for me, it just continues to be this sort of huge web where you're like, holy cow, can't we simplify this thing? We want to hear from you. Your thoughts, obviously, in the Affordable Care Act. Have you signed up? If you have, have you had a good experience? Are your premiums up or down? Where are they at? If you haven't, what do you intend to do? You're going to pay this tax or maybe claim a hardship? Join our conversation at 630POV.com. Mr. Stueland, thanks so much for joining us. Appreciate your expertise. We look forward to hearing from you. We're going to get right back to your feedback.